Hi, Dr. Daffin. My name is Cynthia Murphy, and I'm presenting the preliminary proposal for my project. I've never really had an assignment where I had to videotape myself, so this is really awkward, and I'm trying to get the hang of it. This is probably my eighth take, and I'm surprised I'm not giggling already. The project topic that I am planning on using is relating to healthcare and the patient doctor role, and also, most importantly, the patient role in their own healthcare, their own well being, and how proactive they can be or should be in order to not only prevent illness but to improve the situation. A lot of times, just through simple lifestyle changes, through diet, nutrition, exercise, relationships, interpersonal relationships, many problems can be avoided. Um, I think patients overall have a tendency to be a little, I don't want to use the word submissive, but in a way, yes. They think that the doctor can fix everything, and they think that the doctor can write a prescription and that'll be the end of it. And when in fact, it really is just masking whatever symptoms they've had. In some instances, a prescription does solve the problem, but at the same time, I think you need to dig a little bit deeper. And try to figure out what it is that actually caused the problem to begin with. Um, High blood pressure because of your diet or family history. Obviously, family history, you can't really do a whole lot, but you can do certain things to minimize the symptoms, minimize the effects of such conditions. I think patients need to be educated overall um, with what they can ask a doctor. I think there's a balance issue, thinking that a doctor knows it all and they have the answers to everything when in fact they're human. They don't know everything, and I think as a patient you need to have a voice, have a little more confidence when you go to the doctor, especially nowadays with all the healthcare changes that are going on, where the time a doctor gets to spend with a patient is cut shorter and shorter so that they can maximize their day and be able to cover all the expenses. Um, a patient, I feel, needs to be able to say, wait 1 second, I have questions and I would like answers to them, instead of feeling rushed and walking out of there with no answers at all. Um, the sources that I plan on using have to do with the patient doctor relationship, the balance of power. And according to one of the articles, it deals with the philosophy of doctor patient relationship. And it looks at the history, how this developed. So, this article is the article by Catherine Feste, Empowerment from Philosophy to Practice. According to the abstract, the empowerment of the philosophy is based on the premise that human beings have the capacity to make choices and are responsible for the consequences of their choices. Empowerment is defined as an educational process designed to help patients develop the knowledge, skills, attitudes, and degree of self-awareness necessary, to effectively assume responsibility for their health-related decisions. I think this is a very useful resource to include in my research. It goes to the heart of what I'm trying to present. Um, Also, the other article that I plan on using deals with this aspect from a psychological point of view. The title of it is Patient Empowerment and Control, a Psychological Discourse in the Service of Medicine. It's by Peter Salmon. And the article takes a look at the emerging importance of patient empowerment and participation in helping to manage their health care. Again, I have very strong feelings. I think that patients definitely need to take responsibility for their well being, and not rely solely on the doctor to fix the problems or someone else to fix their problems. I think if you have been putting forth effort in eating healthy, exercising, all the basics that help provide a healthy life, um, which can improve the quality of life, need to be taken into account. They need to be an active role. No, maybe not role, but an active. Hmm. I can't quite find the words to put to this, but patients need to be responsible for their actions. And if you're going to McDonald's every day and can't understand why you are overweight and your blood pressure is through the roof and are at risk for diabetes, something needs to be taken a look at and changed. And I think digging into this topic, it will not only help me understand and be able to communicate a little bit better with someone that I would encounter in my massage therapy practice or in my future work as hopefully a physician's assistant. But I think the overall message to walk away with here is that you can't expect someone to fix your problems. You have to take responsibility for your actions and the results of your actions. So, hopefully, this will be a good enough presentation, and I look forward to your feedback. Thank you. Have a good night.